Hi, everybody. Welcome to this week's 5 Minute Tech Tip. Hopefully, today we'll talk about something that's going to help you in your clinic work today. So, let's get started. This week, we're going to talk a little bit about centering and exposure. Here, I have a couple pelvis x rays that were taken in our clinics. You'll note that the one on the left hand side, you can see the graininess where our exposure wasn't quite complete or we needed a little more exposure technique in order to punch through the pelvis. You can see a stark difference between the one on the right and the left. You can see the graininess. The edges aren't very sharp between soft tissue and bone. Um, it's just not a real diagnostic image. Aside from the fact that it is centered okay, up and down anyway, side to side, we're missing the right side of the pelvis over there. The one on the right, on the other hand, it's a nice, clean, sharp, good recorded, detailed image. We've got good, sharp edges along the bone here between the soft tissue and the bony cortical. It doesn't leave much to the imagination at all. It's all very sharp. If there was a disruption in the bone at all, you'd be able to see it. Um, both hips are flared out, so we got a good look at both greater trochanters. That is done by inverting the toes 10 to 15 degrees when you take the picture. Um, but over here, if you had this image come up, we'd probably have to redo that image. There's just not enough information there to um, make that image look okay. So we would have to shoot that image, a little bit hotter, maybe double your mass. Uh, would probably take care of that problem. Make it look like the one over here on the right, which is a nice, pretty, soft image, very, very diagnostic. Um, the centering is actually between the ACEs, which is this point right here, and the pubic symphysis, which is down here. Okay, so it's midway between the ACEs and the pubic symphysis right here. So centering wise, we've done perfectly. We've included the entire bony pelvis, which we want. We want to see down through the lesser trochanters. You can see one coming in right here, one coming in right here. They're superimposed right now by the femur itself, but you can see a distinct line there and a distinct line there. That is the lesser trochanter. Okay, so yeah, double your mass, center a little bit better. Make sure that your mid sagittal point is right on the spine or the belly button. You'll be in good shape. Let's move on to the next one. Okay, we've got a lateral here. Now on the lateral, we're just going to take a picture of the affected side. And the one on the right, it's a really nice image. We can see that left side femur going into the acetabulum right there, the head of the femur. We can also see the lesser trochanter more in profile with the lateral than we did on the AP view. The greater trochanter is actually superimposed by the neck of the femur right there. You can't see it as well. You can see just a little bit right there, but you can see the lesser trochanter right there. That's what we want to see. We also want to be able to see the entire side of the left side of the bony pelvis. We go over here to the left. Again, we're really grainy and underexposed. So again, we would have made that that change in technique on the AP and reshot the AP, and then we'd use the same technique for the lateral, and we would have been okay. So again, we probably want to double our mass, um, try to get rid of some of that graininess right there, give us a little more information that we can turn around and make that image look really, really nice. So if you're seeing grainy images, it's usually a technique issue. You're not using enough technique for the body part or the side of the patient that you're trying to expose. But over here on the left, it's pretty lateral, very, very, very nice. Good bony recorded detail here. We can see great soft tissue, bony correlation. If there was a disruption in the cortical at all, you'd be able to see it. We can see where the head of the femur fits into the acetabulum right here. You've got a nice joint space going across right there. SI joint is visible as well. All in all, very, very nice lateral x-ray on the left-hand side. However, the right-hand side could use a little bit of work. We're still seeing the lesser trochanter here, greater trochanter superimposed by the neck of the femur. That is exactly what we want to see. However, the technique's just a little bit off. Your exposure needs to be a little bit hotter so you can see that. Now remember, great images don't just happen by accident. Small positioning adjustments can make a big difference. If it's not diagnostic, it's not done. Thanks for stopping by. I went over by about 30 seconds. I'm sorry. You guys have a great day. Pay attention to your exposures. Make sure your images are looking good. Centering is always a big part of what we do. So keep up the good work, guys. See you next week.